Well, welcome again to our monthly webinar, where we reviewed various topics that are relevant to persons who are living with conditions that affect memory and thinking, and for people who are the trusted person or loved one or care partner for someone who is affected by one of these conditions. Today's session is really focused on navigating agitation, sundowning, and behavioral changes at home. For those that haven't met me before, my name is Dr. Joel Salinas. I'm a behavioral neurologist. I'm also the chief medical officer and co-founder for Isaac Health. And one of the reasons why I think it's really important to talk about this topic is that if you are living with one of these conditions, or you are family members or living with somebody who is affected by one of these conditions, you'll notice that what is being affected in the brain is much more than just memory, and sometimes much more than even thinking. Sometimes it's changes with behavior, and sometimes those behavioral changes can include things like becoming more irritable, more anxious, more withdrawn. And as these diseases progress, they can involve other behavioral changes that can be really challenging to manage. One of those things is something called agitation, which I'll explain a little bit. Sometimes people use a term called sundowning that relates to it, so we'll cover that. And then there's other things that can also happen, things like restlessness or personality changes. So we'll go through all of these, and then as usual, we'll spend some time at the end doing Q&A. So any questions that you have, there'll be a little box at the bottom of your window that has a question mark. You can click on that, and then you can enter your questions, and I'll help to answer any and all questions that come through that way. So just to start out, in terms of the term sundowning, so sundowning is can be defined as an increasing confusion that people living with Alzheimer's or other kind of similar neurologic disease can experience as the sun begins to set from so dusk through night. It's something that some people like to also call late day reactivity. It's not a specific disease, but really it's just a collection of symptoms or behaviors that can happen during these times later in the day. And it can include difficulty with sleeping, anxiety, agitation, hallucinations, pacing, and other things like disorientation. When this happens, sometimes this can really be driven by the need to navigate a new or confusing environment. This can happen much more often when someone's traveling with a hospitalization, when they're a house guest, when they've just moved from one environment to another, just basically being in an unfamiliar environment. As you can imagine, also as the day progresses with light changes, that can also make it much more confusing. With spaces becoming darker, for example, our brain starts to become much more active and tries to fill in details. And that can include filling in details of things that aren't there. So people can actually be more prone to developing hallucinations as the day goes on. It can also be due to mental and physical exhaustion from a full day of activities. So, just like how any of us here can start to develop symptoms of fatigue or exhaustion by the end of the day, you can become a little bit more prickly. You can have a little bit less of that buffer to manage kind of feelings or experiences. We know that the frontal lobes of the brain, the frontal part of the brain, or the frontal kind of parietal network is really involved in regulating ourselves, really being kind of that captain of the ship that regulates emotions, our actions, and judgments. But it's also kind of the Achilles heel of the human brain, where alcohol, exhaustion, illness, any of these things can actually start to impact these frontal kind of executive functions. And so, as you can imagine, as the day wears on, especially if you have a condition that's caused brain changes that make it all that much more vulnerable, that you might see more of these kind of impulsive things or kind of much more difficulty with regulating mood or feelings. Um, these things can also become more prone when kind of the caregiver arrangements have changed, or whoever's there at home to provide support, whether that's kind of an adult child or a spouse, and it can change throughout the day with somebody else being there, that can increase the chance of developing agitation. Also, one thing that can happen is kind of a mixed up internal body clock, or some people call sleep wake cycles. So sometimes if you're feeling tired during the day and you're awake at night, that can trigger these types of events. Sometimes it can happen with these conditions is the sleep-wake cycle can be dysregulated. So that way, you're treating the nighttime as if it were the daytime. So the most active time, and the daytime is time where you nap or sleep. And that certainly can increase the chances that, especially at nighttime where there's less people around or the environment is harder to navigate, or it's harder for you to orient, that you'd be more prone to developing agitation. Um, Evening lighting, as I said, can not only make things darker and harder to see, but it can also increase shadows, and the shadows themselves can also kind of make people more prone to becoming confused or seeing things that aren't there, which we call hallucinations. Um, People can also be more prone to noticing stress or frustration in people around them as the day wears on, and that can also be a form of a trigger for them. And then if you are napping or kind of more prone to being in this kind of twilight phase between being awake and asleep, our brain can also make us more prone to confusion, as we have a harder time distinguishing between kind of what is awake and real and what is in our head, and what is it that we are dreaming about, and that can also lead to greater disorientation. So it can be really helpful to identify triggers for sundowning or agitation. Um, some people actually keep a journal. Some people just have like a calendar that they use. Some people have an app, or like a notes app that they use on their phone to keep track of this. It can be really helpful, because in keeping track of kind of what's going on or of these triggers, it'll help you do kind of what we usually consider to be first line for managing these types of situations, which is not medication, but it's actually non-drug interventions. In particular, doing whatever you can that doesn't involve medication to make the person less likely to develop these changes. So you might want to keep track of the specific time of day when these behavior changes happen. This is a really important question that I will always ask. Is there a particular time of day? Because not only does it help us to understand, is it tied to kind of being more tired, but maybe it's transitions, maybe it's specific kind of activities, daily living, like bathing, that can be part of the issue. Maybe it could be hunger. Um, it also helps me as a clinician to help to figure out, if we're going to start a medication, maybe there's a particular time that we can time these medications to help to give you the best coverage. Um, some triggers that you might identify might relate to the environment or the sensory experience that they have. So maybe it's happening when there are like grandchildren coming into the home, or there's a lot of activity happening, that's causing a lot of noise or a lot of stimulation. Maybe it's kind of later in the day where there's more clutter that's likely to accumulate throughout the day, that things can become more disorienting. Um, it can also be helpful to note if these changes are happening when there's a specific ask or request. I commonly hear about this kind of agitation happening with requests around bathing, or kind of brushing teeth, or any kind of personal hygiene. So that can be helpful to know whether it's a specific ask. Um, Maybe it's something that they don't want to do, or they may be kind of a specific trigger for them. There are certain experiences or situations that people's past can start to inform the situation. This may relate to, a particular person in the family that they've had some history with, where they are more prone to become really agitated around them. Something that happens with these conditions is something called delusions, which a delusion is a fixed belief in something that's not based in reality. We often hear about delusions around infidelity, or persecution, like someone's out to get them or trying to steal from them, or if they've had kind of a particular strife with somebody in the family, or somebody around the home. These types of things might be more prone when they're around. And so figuring through whether it's a particular condition or a set of kind of sensory experiences or environments that make them more prone, it might just be a matter of managing that without needing to add on medication. Keeping a diary or a log for 1 to 2 weeks can really help to identify those triggers. You can play detective to try to figure out, like, what was it that was said, what was the particular environment or time of day. Did they seem particularly hungry? Had they not had anything to eat or drink at the time? And just make notes about what happens before those events to help to to sort out kind of what these triggers might be. To manage, common things we'll recommend is to really support routines and rest. So, really encouraging the person living with dementia to get lots of rest, trying to stick to a regular routine of waking up and eating meals and going to bed. I have some patients and families really swear by being very strict about routines. That way, the brain almost starts to kind of rewire itself and program itself to follow that routine. The more rituals there are, the more easier it can be to follow through with things. Some people use music to cue things like cueing that it's time to wake up, cueing time to kind of bathe or get dressed, cueing meals, cueing times to wind down. This can include kind of during the day, having windows open, having lights on, versus when it's time to go to bed or the day's winding down, start to kind of close windows, dim the lights, really winding down as much as possible, getting slippers on or getting more comfortable, having a separate outfit or a kind of accessory that can help to link with these types of routines can be helpful. It also creates a sense of predictability, which can help to manage some of the anxiety that people can have throughout the day. Um, you can try to work your schedule accordingly by trying to schedule activities like appointments, trips, feeding, and other things during times that the person is less likely to develop agitation or be irritable. So sometimes that can be early morning or midday, or maybe there's a particular medication that they've taken. That's the best time to really get these activities in, especially if they're more alert and more oriented. And then kind of getting an opportunity to have more sun exposure can help with that sleep-wake cycle. There's a part of the brain that helps with triggering kind of sleep and awake. There's these kind of in the pineal gland. These are things that kind of relate to kind of being able to understand whether you should be awake or sleep. These are big cues for the body that are biologically ingrained. Also, exercise or regular activities can also help. Um, as you can imagine, when somebody feels like they have a lot of anxiety or they have a lot of kind of emotional kind of turmoil going on, sometimes getting the body worn out with a different activity or basically taking the adrenaline rush that might be going on and putting it to use. Because sometimes call this kind of in psychiatry sublimation, but basically kind of redirecting some of this energy towards an activity can help to serve as an outlet and start to kind of decompress a little bit. Um, Overstimulation, so just really helping to reduce that can help, especially in the evening hours. So, being attentive to what kinds of programming is being put on TV. Do we have a lot of action things, or do we have like the news going on that might be potentially triggering? Are there particular chores or exercises that can be kind of increasing the chances that someone will be irritable or agitated? Kind of music are they listening to? If you can kind of create almost like a routine where the color of the lighting, if you're able to adjust the color of the lighting in your home or use more kind of warm light rather than blue light, that can help. Or start to kind of play more kind of nature sounds in the evening or softer, slower paced the music that they really love that can help. Um, any kind of distraction in an environment can increase the chances that there'll be disorientation or overstimulation, which can make anybody much more reactive, let alone somebody who has a brain that's a kind of change where it becomes more vulnerable to this. Soothing activities can be really helpful. This certainly takes a lot of trial and error beyond listening to calming music that can involve looking at photographs, looking at pictures, things that don't require memory can be helpful. Putting on a favorite show or favorite movie, sometimes very light touching or light massage. Some people really like kind of holding up hands and putting some pressure there, or maybe wearing a piece of clothing that can be really comforting or can be give a sense of security. There are these kind of weighted blankets that are out there. Hasn't been as well studied within people who are affected by these conditions, but like I said, it takes a little bit of experimenting. So if something like a weighted blanket can be really helpful, that can be something you can do. There's also kind of fidget toys or kind of fidget blankets. You can find these online, but basically they give people who are affected by these conditions opportunity to kind of do something with their hands to keep them busy so that way they're not picking at things. And it can also help to kind of calm them and create a sense of distraction. Um, Another thing is just making sure that you have a regular diet. So, eating a balanced, healthy diet, being able to eat lighter meals at the end of the day, so things that aren't as carb heavy or as heavy, like heavy meats, can help to reduce upset stomach and can keep the person kind of feeling kind of lighter and a little bit more reassured in the evening. It can certainly be helpful to avoid alcohol, because alcohol certainly not only creates a greater chance of disorientation or confusion, but also just impairs the speed of our processing of information. I mean, any of us who have had alcohol know that it can become harder to even regulate our feelings, let alone if you've had brain changes that make it harder to manage this, you're just much more susceptible. Caffeine and things like nicotine can also affect the ability to sleep. Can also make us a little bit more irritable, or can make us feel much more anxious or jittery, especially if it increases our heart rate or our blood pressure. Um, there is this thing called restlessness also. So people who are living with dementia or cognitive and or memory issues or thinking issues can also feel more irritable or kind of be a little bit more fidgety. They can involve tapping their fingers or walking up and down or standing up. It might involve like moving objects around or fixating on particular tasks like tidying or trying to leave the house or kind of being really fixated on particular thoughts. This kind of restlessness can be a bit challenging to manage. Things that might contribute to restlessness include increased neurostimulation, hallucinations or changings in visual perception. So, like not having access to your glasses, or if you're having hearing loss, not having access to your hearing aid and having that on. Some medications can uh, cause more confusion or changes. Even some antipsychotic medications can have some of these side effects. People who have a history of restless leg syndrome, um, as can already give you a feeling you need to move your legs or kind of stop an unpleasant feeling, and this can cause you to want to get up and walk around, especially during the night. In people who are affected by anxiety, which does become much more likely with these conditions, um, can it happen not just with being more aware of changes in memory and thinking, but it can get you really perseverative on things that you're losing or perseverative on something that somebody said or that you thought that they said, um, or trying to get back to a previous routine. So a common thing that we hear about is wanting to go home, even though you already are home. And this relates to this kind of anxiety, but also just your brain having a harder time registering kind of the emotional weight of kind of people or places or things. And so you may start to see things as less familiar or stranger. And that can also create a sense of unease, which can then lead to restlessness. Ways to manage this restlessness, find the ways to keep the hands occupied. I mentioned kind of the fidget blankets or the kind of fidget toys. There's a lot of things out there, but even just basically beads. If you are religious, having kind of like if you pray using the rosary or other kind of prayer beads, this could be something that you can use as well. Some people like to have like a box of items that are familiar that you can put your hands in and have really interesting kind of feelings or touch, whether it's kind of like corners or round surfaces or kind of soft surfaces. This can also help with some of that kind of restlessness. Following a routine again is really helpful. Um, we really recommend having some physical activity during the day because that can help with some of these feelings, especially a walk. Some people will pace around, and so just going out for a walk can help to decrease the kind of the body's kind of drive to pace. Um, and this can, of course, also help with sleep quality, ability to rest. Maybe not just before going to bed, because sometimes doing exercise can increase your wakefulness, but in finding a time before the wind down time, where doing some exercise can be helpful. Some people like to have kind of the seated bike, where you have kind of some pedals that you can use or pedals that you can do while sitting up. Some people like to have some squeeze toys that can help. It's any kind of physical activity that you can do. And then this one can seem a little bit funny, but staying hydrated. So just making sure that you're drinking plenty of water, that you're having plenty to eat, limiting caffeine intake. Um, fluids is something that people will often forget to drink, and that can lead to this dehydration or low volume. And so people can feel a sense of fatigue, which can make them more irritable, but also um, once they kind of get up, they'll feel lightheaded, or they'll say that they feel weak. They'll say that they feel weakness, or they feel tired or sleepy, and that's even though they're not falling asleep, can be related to more dehydration than it is actual kind of need for sleep. Um, Other behavior personality changes can happen as well and can have a pretty big impact. Um, you may find that there's a difficulty with understanding what's going on around you. Feeling that you're not in control of what's happening around you can also lead to these issues. There's this whole thing about locus of control, and some people, when they feel that they don't have control over their life, what's going on, right? And as we lose our independence, we can become much more prone to feeling that we're losing control. Some people can act out, and sometimes this is um, really involuntary. It's just your body's and brain's way of reacting to the situation. But sometimes acting out can be a way that we try to assert control, even when there's no control. Um, and all of these can really impact not just your behavior and kind of long-standing personality, but just the quality of life for the people around. Um, these behavioral changes are quite common. Sometimes they are the earliest symptoms of disease. We often see things like anxiety and irritability are some of the earliest symptoms. And this can also include aggression over time, like shouting or screaming, delusions, as I mentioned. These can be really paranoid delusions, delusions of persecution or having things stolen or of infidelity. Hallucinations like visual hallucinations, seeing things that aren't there can happen. Depression, anxiety, or apathy is a common one, so lack of motivation to do things. And these can be really distressing for the person who's experiencing them, but also for families or their loved one. It can cause a lot of distress, and so it can be really helpful to have these conversations in clinic about any other potential causes. Um, you know, whether that's pain that's driving a lot of this or untreated depression or anxiety. Sometimes an infection, like a urinary tract infection or UTI, can be a common culprit. It can also be side effects of medication. So, oftentimes it can be helpful to try to kind of be that pillar and, either easier said than done, but trying to kind of put your late night radio DJ voice on and try to kind of keep the situation as calm as possible and avoiding big confrontations. Um, Oftentimes, this can come from um, kind of needing to repeat things. And so, one thing that people often recommend is to focus less on repetition and in or compliance and focus more on understanding, becoming really curious and trying to understand, what is kind of driving this change. That's why some people use the term late day reactivity, because if the more effort you put on trying to understand what the person is trying to communicate or what their underlying need is, the more likely you are to be successful in managing it without needing to rely on medications. And sometimes that's hunger, thirst, pain, tiredness or fatigue. Sometimes it's kind of a need to feel reassured, or to be in a place that you're familiar with. If these changes happen really suddenly, this could be due to a health problem. That's something that we want to hear about. Um, because these diseases progress over time, we expect to see these changes to happen in the order of months and years. Um, Sometimes it can happen on the order of weeks. Less likely for us to see them to, be a sudden dramatic change from one day to the next, because that usually means that there's some kind of an infection or some other medical issue that's going on that's driving it that oftentimes is quite reversible. So it's helpful to talk to a member of your care team about these changes that are going on, so that way you can get the right support. We're always encouraged to reach out to your Isaac Healthcare navigator or other member of your care team. We're here to help you and your loved one can navigate any of these behavioral changes that are going on. So with that, I will stop sharing my slides so we can turn to Q&A, which is always my favorite part of these sessions. So again, just remember you can always click the Q&A kind of box at the bottom and add your questions. I see we have some questions here already. So the first question I see is, um, what do I do when the agitation becomes physical? What is a safe way for me to manage? Yeah, this is a really tough one. This is a question that comes up a lot. And I think the key thing here is we want to make sure that you and your loved one are safe and out of harm's way. And so if you ever feel that you or your loved one are at risk of harm to self or others, we usually say, call 911. We need to get that managed more urgently. If you ever feel unsafe, especially kind of unsafe because of physical aggression, similarly, call 911, go to the emergency room. We can help to manage these things early. We try to be very proactive when we start to see these changes so that way things don't escalate to the level of a crisis. So we actually want to hear more about this pattern of the person becoming more irritable, having a hard time managing their emotions, than hearing, the last couple of nights they've been really physically aggressive. There are medications that we can help to prescribe in these situations. We like to have plenty of time with medications to be able to get some of the more common ones to build up in the system to get your body and brain used to it. It always takes a bit of trial and error. And so we want to have that time. And so catching these things early and starting to manage with medications early does help with that. But when things are more acute, or we need to manage more on a shorter time frame, then we start to turn to some of these antipsychotic medications. These medications, come with a pretty tough balance because all of them can make the person more drowsy or sleepy. Um, so we have to balance kind of the sleepiness versus the behavior management. It's hard to find that right perfect place. It's a little bit of like finding the right kind of Goldilocks dose, but that's where kind of a little bit of this trial and error experimentation can come in. Um, I see another question here. Um, is the usage of the computer good for them since it seems to upset my mom? Yeah, so I think this is kind of where it can be helpful to really dig into kind of some of the triggers or factors. There is this particular framework that we'll sometimes recommend. Some of you may have heard of the DICE framework. Um, it's meant to give you a little bit of structure to figure through these behaviors. So the D in DICE stands for describe. So describe what happens. So, are they are they pacing? Are they yelling? Is there safety at risk? Is it causing distress at other people? Is there anything in particular in the environment that's going on that might have triggered it? And in this situation, it might be use of the computer, especially if they're engaging on websites or other videos and things that might kind of cause outrage or might cause upset or can kind of really kind of disorient somebody. The I is really investigating the possible causes, so really diving deeper into kind of what specific triggers there might have been, whether it's like any medication changes, if there's an unmet need, like being bored or lonely or being constipated or having hearing or vision changes, um, whether that's also kind of other people in the family misunderstanding the behavior, thinking the person's doing it quote unquote on purpose, or maybe trying to reassess kind of the expectations that we're setting up. Are these expectations being realistic based off of the current abilities? Or is the environment very stimulating? Or is the environment very boring? Or is the environment one that's causing a lot of disorientation? The C is to create a plan. So creating a plan to respond to possible unmet needs, or creating a plan on discontinuing any high risk medications or optimizing treatments or promoting activity. Maybe that plan can include seeking more information or figuring out ways to communicate that are a better fit or less likely to cause agitation or irritability, or planning to work with your care navigator to get some additional training, or planning on how to set up the best environment. That can include like labels and notes around the home. It can include setting up a lot of different kind of lights and sounds to help, or fabrics or kind of situations. And then the E there is evaluating the plan to see if it worked at all. What worked, what didn't work, where was there maybe a little bit of light? The more descriptive you can get, the better. And also evaluating, not just what was tried, but were there any barriers to trying something else? Did we really give it a good enough try or not? So again, just to summarize that again, that DICE framework, it's describe what happens, investigate the possible causes, C is to create a plan, and E is to evaluate that plan. I see another question here. And then just to make sure I close out on that question, the computer use, it can be good if it's helping to keep them distracted, and it's creating kind of a positive environment and helping with positive feelings. But it can also be problematic if it is causing them to become upset or irritable. So we would recommend kind of maybe limiting that kind of time or creating some limits on the kinds of content or material or experiences they have on that device. Another question I see here is to what extent is sundowning actually a symptom of sensory overload and cognitive fatigue rather than just a time of day issue? For example, if a person is clear in the morning, but they have like more of a word salad by 4 o'clock, should we be looking at environmental modification like quiet hours at noon as a clinical intervention? Yeah, I mean, I think sundowning is really just a very kind of general term. It's a bit of a grab bag, but it's meant to describe this phenomenon that is seen in people who have these types of conditions. Again, that's why some people call it late day reactivity, but to some degree, it is related to cognitive fatigue or sensory overload. Sometimes it's just our brain's ability to be able to compensate for the physical changes going on in the brain become much more challenging to manage later on. Our brain um, takes on a lot of like what we call working memory, this mental scratch pad. And so as we're trying to kind of keep track of the activities and things, that bandwidth can get overwhelmed. And so that means that we have less bandwidth to be able to really sort through our feelings, to be able to do self-soothing behaviors or to self-regulate. If you notice when you are feeling really irritable, sometimes you do some degree of self-talk where you figure out what kinds of activities or things you can do to take your mind off of things. And it just becomes much more difficult when you're losing the ability to be able to do that kind of higher order kind of cognitive processing to help to self-soothe. And so I do think that things like environmental modification can be really important. I think quiet hours can be a really great intervention. So, for example, if there's a particular time of the day where people tend to get overstimulated, and again, this is always going to be a bit of trial and error, is freaking out, um, is it better to kind of turn on the volume of things, like have like no TVs on. Um, some people will use actually white noise machine, especially like if you live in the city, it can be a little bit challenging to control noises all the time, especially outside noises or people that are outside the hallway or going up and down kind of stairs. Um, White noise machines or putting on some other kind of whether it's nature sounds or soothing music can be helpful. And there really is, if you just think about the five senses, think about ways that you can engage those five senses in a way that's more calming and really think about things in that person's life that were really helpful. Um, and figuring out kind of what activities can be really, really soothing for that person or have worked in the past. I mean, what worked in the past, maybe it doesn't work and you try to find a new one. But I think part of this experimentation can be really helpful. Another example of some of these activities that I've heard of that can be really effective is things like folding laundry, doing things that are really kind of repetitive and pretty straightforward that kind of match the person's ability. Um, for example, participating and helping with cooking in an activity that the dinner isn't really fully dependent on or can be very straightforward, whether that's like sorting through like beans or rice or helping to prepare something very straightforward or like setting the table. Again, very things that are kind of soothing, help to kind of keep the person oriented and is less likely to cause a sense of just kind of irritability. Um, some people can feel really bored at the end of the day, and that's part of the issue. And so finding activities to engage them in can be good, whether that's like an art kind of activity, like working with like watercolors or with construction paper, or or knitting or kind of needlepoint or anything that that the person is willing or open to engage in that'll kind of keep them attentive. And I gave the example of like the fidget blankets and the fidget toys. That's another example of things that kind of keep the hands busy and moving and kind of keep the brain's attention that can help to move away from like perseveration or kind of repetition of thoughts or becoming very restless and trying to figure out kind of something to do. Um, the next question I see here is we're worried about wandering at night. Are there medications that help specifically with sleep that can get some help with getting some rest? So, medications, first, we try to focus first on non-medication options. And that, there's a lot of materials and resources out there. You can certainly talk to your care navigator about getting access to some of these, but we often call these like sleep hygiene. So, like putting phones away or kind of reducing the amount of blue light or kind of stimulating things like loud TV shows or stimulating things in terms of like visits and things like that. Um, that can help. Having like a routine. There are certain apps that are out there you can download that can help with the sleep routine, but even if you just play the exact same chimes or the exact same song or album can help to program the brain to kind of consider this as time for rest or sleep. Being really routine about the timing of sleep can also help with that sleep wake cycle. So we'll often talk about during the daytime, windows open, lights on, keep things active and moving. And then in the evening, kind of dim the lights, windows close, um, kind of moving to the bed when it's time for sleep or if someone's really tired. Um, there are medications that we can sometimes lean on. We try to start with melatonin at a pretty low dose. Melatonin, interestingly, is one of these kind of supplements. It is over the counter and it tends to be more effective at lower doses than higher doses. Um, we'll often recommend to take it regularly to help to kind of set that sleep wake cycle. Some people say it's better to kind of space out how often you do it. I think the key thing is routine from my perspective. There are stronger medications. There's medications like trazodone. There's a new medication called Belsomra that specifically helps with sleep with these conditions. It is a controlled substance, but it works by specifically affecting a collection of neurons that are involved with orexin that helps with kind of regulating sleep and wake cycles. Um, Generally, we try to avoid treatments that are too sedating because it can cause confusion or can increase risk of falls. Imagine the person kind of gets up at night and they try to kind of get around, but they're very drowsy because of the medication. Common medication we'll try to avoid after age 65 is something called benzodiazepines. So these are kind of the azepam type of medications, like alprazolam is a common one, or clonazepam. We usually only reach those when we absolutely need to, just because of the risk of confusion. Um, there are other medications too, like a medication called mirtazapine. There are some antipsychotics that help with sleep. So there's a lot of options for medications. It will take a bit of trial and error. I think the key thing is that these medications don't necessarily help with the sleep quality, but they do help with getting to sleep. As one other thing I'll say with kind of non-drug options for sleep is if people have to get up to go to the bathroom, we'll often recommend kind of decreasing the kind of any additional like drinks or anything like that within a certain number of hours. So, maybe the last kind of drink of water being around like 5 o'clock. If you're planning to go to bed by 8, that way you're less likely to have to go to the bathroom at night, which will wake you up. The next question I see here is sundowning a permanent part of dementia? Um, well, sundowning, or this late day reactivity, it can happen during any of the stages of dementia, mild, moderate, or severe. It just can manifest differently. We do see the more extremes of the agitation, particularly when people are coming into the mild, entering the moderate stages of disease. By the time someone's at the severe stage of disease, sometimes that starts to go away, but that's mostly because the disease has progressed to the point where the person becoming less verbal, having a harder time just kind of really interacting with the environment around them, or the apathy has become so great. So, it can be particularly problematic during the middle stages of the disease and really start to come into the earliest stages. We can still see it in the severe stages, but it becomes sometimes less prominent as an issue. The next question I see here is, um, I get frustrated when I can't do simple things that I used to do easily. How can I calm myself in these situations? There's a lot of really great kind of exercises that you can do to help with soothing. Again, trial and error. Um, there are breathing exercises that can help. One of the breathing exercises that I will often suggest is one that has a lot of evidence actually behind it. It's called cyclic sighing. Some of you may have heard of this. I may have mentioned it before as well, because I really do think it's really great. And it's evidence-based. So cyclic sighing is this particular type of breathing that helps with slowing your heart rate, your respiratory rate, and has been shown to help to reduce anxiety and depression when you do it for 5 minutes, at least kind of once a day over many weeks. It can also help with kind of that self-regulation and helps kind of boost that parts of our brain that help to regulate. So what it is taking a deep breath in through the nose. At the top of that breath, take an extra like last sip of air, and then a slow breath out. And what happens in the kind of breath in through the nose, we're expanding the chest. We're starting some parasympathetic nerve stimulation. That's kind of helping with the rest and digest part of the nervous system. That extra little sip of air at the top is actually expanding more of the alveoli in the lungs, expanding the chest just a little bit more to get that little bit more of that parasympathetic stimulation. But what's really, really powerful is the long, slow exhale. So we do know that the long, slow exhale, this with the long, slow, deliberate exhale, is much more likely to slow the heart rate and slow the respiratory rate. And these things are kind of taking our body from this kind of fight or flight kind of mode to more of this rest and digest mode. Sometimes people just need to take a break or pause, and that can involve going to a different room, going to a different environment, finding something to distract yourself with, or whether that's like a game, a book, music, going outside, going on a walk. Um, Other things that can help with self-regulation, kind of there are strategies that may seem a little silly, but it can actually help with resetting the nervous system. So one example of that is splashing cold water on your face, or they sell online. You can find anywhere these kind of cold packs that are for like the forehead or the face. Well, we know there's this thing called the mammalian dive reflex. That's just part of our nervous system. It relates to something evolutionary. We see that in animals that kind of dive into the cold water, where it helps to actually slow your heart rate and your respiratory rate to conserve energy when you're underwater. So what we know is that when you kind of apply kind of a cold temperature to especially the face, we start to see decreases in heart rate and respiratory rate. So it's really finding ways to help to reset the nervous system. And that in and of itself helps to kind of provide messages from the bottom up to the brain to say, you're okay, you're safe, the situation is reassuring. As even when there's a lot of these kind of messages or loops going on in the head, this can help to kind of short circuit that a little bit. There's this other framework that we will sometimes describe called the 4 Rs that can help with this. This may be more specific to kind of care partners or support partners, but can be relevant if you're experiencing these issues. So the 4 Rs are reassure, routine, reminisce, and redirect. So the reassure step is providing a lot of consistent communication, speaking calmly, using a soothing tone, that kind of late night radio DJ voice that I mentioned, being really consistent in your voice and actions can help to build trust, helping to provide physical comfort. Simple things like holding hands, people do like the hand over hand can be really help. Offering a hug or a gentle touch, kind of or like kind of like massage on a part of the body can help. Providing positive reinforcement, praise, or kind of helping to use kind of positive affirmations or phrases can be helpful. And then kind of really helping with the ensuring that the environment is safe. That can include reducing clutter, making sure you've got adequate lighting. All these things can help to reduce confusion or anxiety. The routine R is around kind of, I've mentioned the daily schedule, having simple tasks, having consistency around things. Even if you have some consistency, you can remain flexible and adapt to that routine. But routine can be really, really helpful. And a lot of people who, regardless of what's going on in their brain, who are more prone to difficulty with regulation throughout the day, having a routine helps to create a sense of kind of predictability and also helps to kind of lower kind of the sense of threat that you might have. That third are reminisce. So this can include looking at photo albums, looking at pictures, listening to familiar music. We often say that like particularly music that can evoke memories or positive emotions. There's something about music that we heard in our late teens and early 20s that seems to be really powerful. What I'll often recommend is actually figuring out kind of what was the era or the year range when your loved one was in their kind of late teens, early 20s, and then getting some music from kind of the top 100, the top 10 list on the radio during that time. And you can kind of see that there's just kind of a very different effect that can happen that can be really, really grounding. Some people also create things like memory boxes, things that hold sentimental value, like letters or souvenirs or keepsakes, which can be helpful. Yeah, I encourage you to think about like reminiscence. So like there's this thing called reminiscence therapy. So if you just look at a picture of, cars that you've owned in the past or a home that you owned in your past and you thought about it, I invite you to kind of reflect on what's going on in your body when you're thinking about kind of something that happened in the past, a place that you used to live in or memories from the past, which, has its own kind of calming effect. And then the last R is the redirect. And this one is the one that we often will talk about. And this is a lot around distraction techniques. So pivoting to a favorite activity or a snack or going on a walk to divert attention, kind of moving to a calmer environment, like moving to a different room or a quieter area that might reduce the stimuli that's causing the agitation. Um, Engaging in activities that can involve the person, something really simple. Like I mentioned, the examples like folding laundry can include drawing or playing with a pet. Um, and then providing some gentle suggestions to help to shift their focus. So again, focusing less on correcting or arguing or confronting or repeating and focusing more on a curiosity of understanding what's going on. Really thinking like, what are the things that are escalating the agitation? What are some ways that we can start to de-escalate that situation? So again, those four R's are reassure, routine, reminisce, and redirect. I see another question here. Um, so how can I make sure my wife who has dementia is safe when she's outdoors? Do you have any tips? So spending time outdoors, I think the key things are, does this person need supervision? We generally will recommend having something like a smart tag or some GPS turned on the phone or watch to track. It can be helpful to have bounds for the outside. So whether that's a backyard or a particular park that's kind of well enclosed can help to reduce risk of like wandering or getting lost. It can be extra safe. Having some degree of supervision, whether that's through technology or having someone kind of there with them can be helpful. There are certain service animals that actually can help with kind of providing a little bit of the safety where they can alert when something's kind of gone awry. And I think there's other things like the basics of just kind of what are the surfaces like? Is it lots of steps that are kind of low lying? Is there a lot of instability, like in terms of rocks and kind of like broken kind of planks or things like that, or unlevel surfaces that can increase risk of falls that we can try to avoid. Um, and then being within earshot helps, being able to kind of visualize your loved one, kind of wherever that can also be really helpful. And then the last question I see here is I feel pretty overwhelmed by the behavior changes. how can Isaac help me with managing these situations? So for that, that's really working with your care team. So you've got your care navigator who should be able to help kind of troubleshoot a bit, kind of provide some basic counseling, provide you some resources, do some coaching around common things that can be really helpful. Then your provider can help with medication management or helping to sort through some of the medical things. Is there a medication here that could be causing issues? Is it the timing of some medications? Is it potential side effects? Is it something that's sensory wise that we can help with? This is the kinds of things that they can help with. But I think more than anything, especially your care navigator, they're there to help you kind of tell and retell your story and what's going on, and that can help with just a lot of the coping through these changes as they're happening. And also just helping to um normalize the experiences that you're having, and sometimes it can be helpful to connect you with a counselor or a therapist. We do have lots of access to lots of different support groups. We also have access to psychotherapists that can help with kind of specific counseling around coping and managing the grief that can come with these changes, especially behavior when your loved one is no longer acting like the person that you married or that you knew. That is a big change in your role that you play and a big change in the relationship. And sometimes it involves grieving those changes. And I think that's both for the person who is experiencing those changes and the people around them. I think it's really healthy and important to go through the process of grief. And we all grieve very differently. Sometimes it can be helpful to have the assistance of a professional to manage some of that grief, because that grief will catch us at some point, and it comes up in the moments that we least expect it, in the ways that we least expect. And so having professional who can kind of really have a protected space for you, a low risk space, and help to kind of guide you through that process can really help you navigate the distress that can come from a lot of these changes. It's a behavior changes is a big topic. It's a hard topic. It's one that we try to be really involved in managing upfront and early. We want to make sure that everybody is as prepared as possible. And even if you feel 100% prepared, things will happen that you didn't expect, but at least having a better sense of reassurance that you have a plan in place for when something does happen, including reevaluating that plan and making changes to it, I think can be a big help. And with that, I just wanted to thank you all for joining us today. If you have any additional questions or need some additional resources, please don't hesitate to reach out to your care navigator. And take care. And I wish you a really nice evening. Take care. Bye bye.